Hello and welcome to Great Plains Quinn Friday Focus for Health Pathways to Safer Opioid Use. We welcome you. This Friday Focus for Health is hosted by the Great Plains Quality Innovation Network, the Center for Medicare and Medicaid Services Quality Innovation Network, Quality Improvement Organization for North and South Dakota. My name is Tammy Wagner. I am a Quality Improvement Advisor for Great Plains Quality Innovation Network, and I want to thank you again for joining us today. Our team members for this opioid series, along with myself, are Stephanie Hansen, Jennifer Lochner, and Carrie McDermott. Before we begin, there are a few housekeeping items to review. Today's webinar is being recorded and will be posted within 1 to 2 business days on our website at greatplainsqin.org under the Friday Focus for Health link. We will have an office hours format for questions and peer sharing between organizations, but you can also add any questions to chat and those will be addressed at the end. We have added a resource handout that you can also access, and this resource handout includes all the resources or links shared during today's session, and then we will add to it as the 4-week series continues. So without further ado, today nearly every community has been affected by drug addiction. As the prevalence of substance use disorder or SUD and drug overdose deaths continues to rise in rural areas, drug use can no longer be viewed as an urban and inner city problem. Beyond zip code, drug addiction is impacting individuals and families from all socioeconomic groups, changing the image of a person with SUD or substance use disorder. Someone struggling with an addiction could be a working mom, senior citizen, pastor, coach, high school athlete, or college student. So our 4-week action group will learn more about opioid misuse and opioid adverse drug events. Today is week 1, and this is an overview. And week 2, we will have how to work with pharmacists in our opioid efforts. Week 3 will be how physicians and nurses impact opioids. And week 4 will be patients and families and how we can utilize teach back with our interactions with them to help reduce opioid adverse drug events. So we will begin by briefly discussing the age-friendly health system and the 4Ms framework. This framework can help achieve safer and better care for our aging population. Of course, many of you have processes and procedures that are already age-friendly. The 4Ms is an easy to understand framework. Age-friendly health is a person-centered approach to maintain the health of older adults based on evidence-based care that improves health care and prevents avoidable harm. Age-friendly health employs a framework called the 4Ms. So as you can see, the 4Ms are what matters, medication, mentation, and mobility. So what matters? Know and align care with the older adults' health outcome goals. Medication, if it's necessary, use age-friendly medications that don't interfere with what matters, mobility or mentation. Mentation is to prevent, identify, treat, and manage dementia, depression, delirium. And mobility is to ensure that all older adults move safely every day in order to maintain function and do what matters to them. If you weren't able to join us for our launch on December 6th, please make sure you go back and watch that recording for more information on age-friendly health and the 4Ms. So how do opioids affect or influence each of these 4Ms? Opioids affect all 4 of these. They are a medication. They can affect mentation, mobility, and that what matters. When we talk about age-friendly health and opioid use, medication stands out. They may be necessary, but they may not be. Opioids are not an age-friendly medication. These meds can affect what matters to the older person, their mentation and mobility, increasing the risk for falls due to drowsiness or dizziness. Opioids can affect mentation in the older adult due to euphoria and that longer half-life in older adults who don't excrete medications as well. So dosages are important. Length of time the older person needs to be on the opioid, if at all. Can we look at other non-narcotic medications or other modes of therapy? Have we tried? This brings up a question that we have been discussing internally about all the times that we've seen in our um, experience that pre-medicating in the hospital and nursing home prior to a therapy, a physical therapy session, or restorative program exercises. We need to ask, do they need it? Have they asked for it? And sometimes just that movement and exercise can help those aches and pains.